Assalamu alaikum. My name's Nyrah. I'm a GP pharmacist and I'm your host for today's health show on British Muslim TV. Now, in today's topic of discussion, we will be talking about child's health. Now, so far, we've only been really discussing, mental health in adults, touching on weight loss in adults. We haven't really spoken much about children, babies in particular, because COVID, let's just face it, COVID has impacted both adults and children. So I thought this was a really important topic we actually introduced. And I've actually invited a very good guest. Her name is Dr. Hazel Fofie, and she is a podiatrist. And I'm so pleased to have her on the show to answer a few questions. Hi, Hazel, how are you?
Hello, how are you?
Yeah, thank you so much for coming on. Great to have a podiatrist on the show. I've been meaning to actually interview a podiatrist for the health show. Be great to actually start off the show.
I'm definitely not a podiatrist. Pediatrician, often mistaken.
Oh, pediatrician, sorry. Yeah, no, it's funny. I said podiatrist. I was speaking to a foot doctor the other day to actually come on the show. Sorry about that.
Oh, wow. Yeah, it's fine.
But that'd be quite an interesting topic to talk about. So you're a pediatrician. It'd be nice to talk about, your current role at the moment and what you're actually doing.
Yeah, so I'm a pediatric doctor. So essentially, that is a doctor who specialises in the care of children, so from age 0 through to 16 to 18, and sometimes even longer, to be fair, depending on if the child has any other condition. So yeah, it's quite a varied specialty because you're dealing from premature babies through to teenagers, so and young adults. So yeah, that's essentially what I do.
Perfect. And just a generic question, why do you think it's so important that we're actually taking children's health into consideration? Children's health is so important, for their development. Why is it important that, parents are aware of their child's health in general?
Yeah, I think it's really, really important. And to be honest, with time, we're learning that whatever experiences, so not even like medical conditions, or I should say not even physical health necessarily, but mental health of children is really important and does play a role in their later lives. And it completely makes sense. We know that prevention is better than cure, certainly cheaper than the cure. And so with that in mind, you have to think, okay, even before you have the child, there are things that are really, really important to be aware of. And children are the future, and they are our legacy. So it's important that we look after them and put them first, 100%.
Definitely, no, it's such an important point. They are the future, and it's important that with advanced technology nowadays and health, that we're keeping up to date with building their immunity. And there are so many myths online surrounding healthcare in young babies, what parents should and should not do with their children. Coming across one statement, do babies have everlasting immunity in the first few months of their life because of their immunity, passive immunity they get from their mother? How long does immunity usually last for when a baby's actually born? Do you know any of those facts that you can kind of enlighten us all?
Sure, enlighten, that's a strong word. So yes, we do know that there is such a thing as passive immunity. That's where mum's antibodies, which are sort of the proteins that the body makes to respond to infections. There is a transfer of that via the placenta and also through breastfeeding as well. And give or take, we say about 6 months, which is why generally it's recommended to continue breastfeeding until about 6 months, if you can. But yeah, that's roughly what the guidance is. And if you can, 18 months even, that's WHO guidance. So that's sort of the World Health Organization, and the UK is, I think about 6 months is just fine.
Sure, so you should definitely kind of consider breastfeeding, definitely a minimum for at least first few months of any newborn's life. And just moving now on to COVID in general, I think I was looking at statistics online a few days ago, and I think since the pandemic started, the number of deaths in young babies under 1 year old have actually only been two. Now, obviously, that's great and that's bad news. But, from your perspective, working alongside the children on the children's ward, how has COVID impacted young babies?
So, the direct impact on children in general is low, is considerably lower than with adults. That's not to say that they don't get it at all. They're just not as severely affected physically by it. But I think it's important, as I said, because we do know that certain experiences, and it's that sort of like nature, nurture sort of argument, because the environment is going to help because of COVID. We've had to make a lot of changes to our lives, which has impacted the lives of children, school, for example. With babies, even that loss of interaction that they're getting from nursery, time will tell, but I think it's really important to bear in mind that it's not just the direct effects of COVID, albeit that it's relatively very rare for a child to be or baby in particular to be very affected. It's not impossible, and we do see cases, for example, of the PIMS TS, which is the pediatric, essentially it's a inflammatory response that the body has, that we see with children who have had COVID. So there is still that risk of serious illness, but on the whole, thank God, they're not directly affected. But as I said, we do have the wider societal impacts to look after, to look at, as well as education as well.
Definitely. I'm glad you touched on, schools, because COVID's not only just affected, healthcare and our immune system, but it's affected school and daily life, and such a big impact on, GCSE results, A levels, big decisions we're making on a day-to-day basis. And in terms of, signs and symptoms, say a young new mother was at home with a newborn baby, what signs and symptoms would you suggest, might require urgent referral, to their local surgery or for NHS 111 as another referral system? What signs and symptoms would you suggest, hold on, needs to be referred?
Yeah, okay, so I think it's quite important, particularly with children, for us not to just think any fever, it's COVID, because the likelihood is that it's going to be millions of other viruses that are still there with COVID. So it's really good in that, because the mechanisms that we're using, so things like washing hands, mask wearing, and all these things, it's going to have beneficial effects against other viruses, but in particular with children, I think if there is a serious infection, symptoms, sorry, I should say, high temperatures, that you're struggling to get down, in the case of sort of using things like paracetamol, if that's not helping, we need to see the child, not necessarily in hospital, but certainly being reviewed by a medical and professional, or via 111, or seeing someone in person. Particularly temperatures fevers in children or in infants less than 3 months, that is quite concerning, just because their immunity, they're still at risk. As you said, the protection that mum gets, the baby gets from mum, can last up until 6 months, but less than 3 months, it's still quite a risky time. And so any fever in that age bracket, it may well be a virus, but it can be something as severe as meningitis, and we don't really know until we see the baby and do blood tests. So I think if you're worried, if baby's having a high temperature, not feeding, because babies can't really tell us a lot. They can't, in terms of, they're not speaking yet a lot of the time. So you are going to be guided by, the presence of wet nappies, hopefully the absence of fevers, their energy levels, their activity levels, them not waking up for feeds, because that's all they really do. And they're sleeping like 18 hours of the day, certainly for the first few months. So if you're having to wake them, then that's something that's concerning. And just go with your gut. A&E's open 24/7. COVID, no COVID, hospital is still open. So if you're worried, that's what we're here for. So I don't want any parent to feel like they're having to suffer in silence, because that's something that's really important. We did see that some families were very fearful of coming to the hospital because of the fear of catching COVID, or their children catching COVID. But I just really want to stress that put your the safety of your child first. And we know that COVID does not affect them in the same way that it affects adults. And so if your child is having a fever and you're worried, seek help. Simple as that.
Definitely. No, such an important message as you kind of shared. And it is important that, we are speaking up as many times as we can, really. We notice a change in the children's behavior, just something physical, something's not right, to then speak up. And it's okay, if you can't obviously go to speak to your doctor, you go to the pharmacist. Pharmacies on the high street, they've been first line during the pandemic. Speak to them and they can kind of do an assessment. If they feel as if there needs to be a referral, that referral can be done urgently. So definitely thank you for, kind of letting us know that there are healthcare professionals out there that will assess your baby if the baby does have any urgent needs. That was a really insightful part one of the show. Join us again for part two. We'll be covering a bit more about children's health, including their vaccinations, the MMR vaccine especially, and also myths surrounding the COVID vaccine and fertility. So, there are a lot of myths online surrounding the COVID vaccine and, difficulty with becoming pregnant. So we will be touching that again in part two. If you do have any questions all throughout the show, you can send your questions in using the WhatsApp number on the screen. And if you missed part one of the show, you can watch a repeat on our Facebook Live. Join us again for part two. Thank you so much for watching. Thank you. See you soon. Welcome back after the break. My name's Nyrah, I'm a GP pharmacist, and I'm your host for today's health show. Now, in part one, I introduced our lovely guest, Dr. Hazel, and we were speaking about children's health, and most importantly, how COVID has impacted both children and babies specifically. In part two, I have a lot of questions to ask Hazel. Hopefully, we have time to cover them all. Hazel, so thank you so much for joining us again. I thought we'd just jump straight back into it. I wanted to actually ask about long COVID. Now, long COVID has actually affected a lot of adults, more than we think. Do you know anything about long COVID in children or young babies? Are children also at risk of having long COVID if they've already been diagnosed with COVID before?
Yeah, so we are seeing that there are quite a significant number of young people that have been affected by long COVID. I was actually in a webinar yesterday, and it was the NAE, so the National Institute of Health Research, which were just really insightful, just collating all the evidence that we have so far about COVID, predominantly in adults, but then there was quite a significant lecture, and the research is still ongoing, but how it's affecting children, young people, and teenagers. So it's definitely something that is, it's something that we should really take seriously. So I said, while you may not necessarily need to be very, very sick from COVID, but definitely long COVID, irrespective of if that acute illness was mild, can linger, and we are seeing that, definitely.
No, interesting, and I think some of the symptoms are overlapping with some of the adult symptoms. So I think the ongoing cough longer than 4 weeks. Are there any other symptoms that you can add to that?
Headaches, sort of persistent headaches, breathlessness and fatigue, just being able to do the things that you normally would do with ease. So that's the child not being able to be as physically active in PE, or struggling to get out of bed. And the cognitive decline as well is something that we are seeing a bit more. What else? Some have long fevers. It's quite a catalogue of different illnesses or symptoms rather. It can be quite debilitating as a young child, as a young adult, adolescent. The impact on social life is really important. It's quite significant, and I think that's something that we should definitely take seriously, because I said all these things can impact if you're actually not having the energy to get up and go to school. You're falling asleep because you're fatigued. That's going to have an effect on the trajectory of that child or young person going forward.
Definitely, of course, and I've actually heard with some of my patients whose children has actually had COVID. Loss of taste or smell apparently can take up to 6 to 12 months to actually regain your sense of taste and smell back after having a COVID infection. What I'm saying to a lot of patients is that even if you keep a symptom book or a symptom diary, just to note down any changes you feel has happened after your COVID infection, and then take that towards the doctor so they can have a better kind of clinical history of what symptoms you've been through and how best to help you. I think there's a lot of long COVID clinic centres available now. And just moving on now to COVID itself and catching COVID. If a young child has been in contact with someone with COVID, what should their parents do? Should they just isolate them completely? Should they take a lot of time off school?
Sure. I think the current government guidance, I think, is quite thorough. So I would definitely, if the child is not acutely unwell, and by that I mean they are conscious, you do have the time to just go to trustworthy resources. So that's NHS website, school, COVID guidelines, child. It will tell you, how to get that child tested, and then the isolation that needs to happen as well. So I think, and then of course, as you mentioned before, your GP 111, all these are very accessible people that you can access help from. So I think those would be just follow the government guidance.
Yeah, definitely. I think important thing to note there is, as soon as the raised temperature, to take that test, you can do the test in, for example, 1-year-olds, and it will still be very accurate. And self-care tips at home for young babies suffering with COVID or the runny nose. So my top tips are, steam inhalation. You can use that in young babies. Obviously not Vicks for anyone that's under 1 year old, but you can use, like, for example, Obus oil, sweet lemon and honey drinks for anyone that's under 12 years old. Any other top tips you would provide for young babies or young children at all that's actually going through COVID right now at home?
Honest, it wouldn't be anything different to the advice that we would give for other viral illnesses, and the likelihood is that, as I said, COVID in children is not going to be the same. It's not going to be as severe as in adults the majority of the time, and that is something that we know. And so I do think, while it's important that if they have a temperature and they're feeling not well, it's good to get that test, because that's going to impact the isolation measures, and it's good for sort of public health direction. But in terms of treating the child, we don't have an antidote for many viruses, and so it's going to be supported. So if they have a temperatures, I mean, I don't know whether you've had a temperature now, but I've had one, and you feel exhausted. I think a temperature in a 38, even in an adult, will knock you out, and how much more a baby? So they're going to be irritable, they're going to be cranky. So things like paracetamol, steam inhalation, I think, as you said, I probably wouldn't go to that because of the age that you've just said. But I think it's just important to it's the same. The basic management is relatively the same, and keeping the temperature down. If they're not eating, fine. Just make sure that they're hydrated, because that's one thing. That when you have a high temperature, you tend to sweat, and you're losing water through that. So you need to sort of top that up. So that's really important. Bring down temperature because that's going to make them feel better. Keep an eye on their fluid intake, and keep an eye on their nappies, because any absence of nappies, we need to review them just to make sure they're not deplete in terms of fluid.
Definitely, and keeping those windows nice and wide so there's always fresh oxygen in the room. And now COVID has had a big impact not only on GP appointments for day-to-day patient appointments, but it's also affected childhood immunizations. Now, I think there was a lot of controversial news surrounding childhood immunizations. A lot of patients were actually scared of having the childhood immunization vaccines after the COVID vaccine was actually rolled out. One vaccine in particular, which has actually seen a decline in vaccination rate, was the MMR vaccine. What are your thoughts on parents actually missing out on childhood vaccinations? Why is it actually so important? We're always keeping on top of childhood immunizations.
I mean, the national immunization has never it's always been encouraged. Even in lockdown, GPs and nurses were still giving vaccinations. But we do know that, particularly with the MMR vaccine, the last decade, we're at the lowest numbers, the lowest uptake rates in about a decade, which is very concerning, because measles in particular is very contagious. If you have one child who is infected, 9 out of 10 people who have had contact with that person can become infected. And the symptoms do range from, I wouldn't even say they're very mild, they're moderate, to potentially having a severe pneumonia, so that's a chest infection, to then some brain damage and can cause death. So although measles is something, particularly in this country, because we have had relatively high vaccination rates, is something that we don't see, but we are seeing that it is on the rise. And this is even before COVID. So you can imagine it's no surprise, sadly, that there has been a drop in the uptake. I think some areas in London were down to sort of 73%, which is really bad. The guidance from the WHO says that every country should have at least 95% of the population vaccinated. So if we're talking some parts are down to 73%, that's very, very concerning, because any little drop just gives room for that virus, which, as I said, is very contagious, to just wreak havoc.
No, definitely. And I think any more information on the MMR vaccine, you can actually find, on the online NHS website. Are there, as we are coming towards the end of the show, do you have any nice online resources or any other last word you'd like to share with our viewers?
Yeah, I think just because we touched on MMR, I know there was a lot of, sorry for the background noise, it's all kicking off outside, but there has been a lot of controversy, particularly, in the last sort of 2 decades, with links to things like autism and bowel issues, and that's all been debunked. So I think it's really important. There is, with the evidence that we have now, there have been countless studies that have been done since that controversial study was done, which has all been disproved. So I think it's really, really important. I just want to hammer that home. That's just to reiterate that the MMR vaccine is safe. In terms of resources, as you mentioned, NHS
Thank
website.
you so much. Thank you so much, Hazel. You've been a brilliant guest and such an important healthcare topic today. And, you know, one of my favourite topics to talk about, children's health. You know, if you do notice anything's changed with your children, their symptoms, their behaviour, do speak to your pharmacist or your doctor. I'm your host, Nyrah Saleem, and this is your health show. Thank you for watching.